I wanted to help out. I wanted you to, speak with her, but I didn't think she's actually going to go forward and actually put the effort in and pay out of pocket with you guys. I know you guys are great, and I referred her to try to get some, credibility or clout in the relationship or whatever. But the referring person said, if you helped her and you got rid of her knee pain, she wouldn't have anything else to complain about.
Yeah.
And some people, their identity is wrapped around that issue or that condition. That person not only we got a live YouTube comment, Tony, from Feel Better PT, Heather. She said, because earlier we were talking about when Jackie mentioned current medicine, and she said current medicine is a great name for an E-stim protocol.
Yeah, it is. That could be the whole practice.
Actually, that's what I like, what you envision and what I envision. I can honestly say I'm kind of disappointed in our professions. I'm disappointed. I'm disappointed in myself a little bit, and disappointed in our profession, because I feel like there is no other healthcare practitioner that spends this much time with our patient, and we can give that much impact. And it's so conservative, and it changes people's lives, and we get paid peanuts. And I feel that, like, I have a nephew right now who's going to be graduating from Seton Hall and their PT program, and just hearing about some of his clinicals, and we have a student right now, and what the clinicals are out there. I'm like, we are watering down our profession, and our solution in general is we'll just see more patients. We'll just see more patients per hour. And over time, you water down the effectiveness in what you can do. And I feel like that's what I want to do. I want to say, you can have this machine, but it's how you use that machine that can make it like a ton more effective. Like, we didn't even start with, I was going to bring my butcher pan. I was going to bring my, we use the gloves. I use a vagus nerve. We use it a lot for the vagus nerve. And like, I have a little mental research thing in my head. I'm taking measurements about why are we having all these manips, and what's the underdriving factor with arthropfibrosis, and how does that tie in with how we can use the newbie and use the newbie in different ways that really makes a big difference. Yeah, so it's the lead domino, and I think to expand the possibilities, and that's really what I want to do.
So Will Boyd's here. Will Boyd says, amazing collab. I know, Will, we got to get you up here. Pittsburgh's not that far away.
That's 5 hours.
How does the newbie device allow you guys to do vagus nerve stimulation? We have a different device called the Stim Pod, and it's pulse radio frequency stimulation, and it's got a ground pad that's a sticky electrode, but then there's a treatment pen, basically like a probe or a pencil, and then you would put it on. You would just put it wherever with a little bit of ultrasound gel for conductance, and then with that pen, we do right here inside the ear, not like external auditory meatus or whatever the anatomy is. That's how we do vagus nerve stimulation with the Stim Pod. What's the electrode placement for the newbie when trying to do vagus nerve stimulation?
Okay. So we actually do two things. When we know that somebody has vagus nerve involvement, we use a frequency specific microcurrent, which is actually, you can use the newbie to adapt your treatment to include frequency specific microcurrent. And so we'll use different specific frequencies with that, and we'll use wet toweling. So we'll use a wet towel at their forehead and around their neck. So we'll sandwich their neck and head. And then, so we'll use the newbie in that capacity. And then we also there's a silver mesh glove. And so I'll use one of the electrodes that will be back on the neck. And then I'll use my silver mesh glove, and then I'll go right into right along here. I'll actually work in and around the ear and down in through between the jugular and the carotid artery.
I want to use the glove. I want to use the glove so bad. I want to be like the movie, the character in one of the X-Men or whatever. I just want to snap it.
So Jackie, what else has been surprising? You guys were part of that Facebook group for the neurological conditions. So that makes sense. what are some of the other things that you've used Newbie for that maybe are lesser known across the US? Like I know like there's like the reset, like there's like the electrodes are put on you have a patient lay supine, and is that, what's it called? Like something reset?
The master reset. And what's really, really cool, we also do heart rate variability. So what we'll do is we'll assess them with a software, a computer, and we'll do heart rate variability tests and to see what is their neurological health, which that is one of the lead predictors of your overall, what is your health and what is your chronological age compared to your biological age. And when your nervous system is unable to adapt, those readings will be way off. And people say, "Oh, I can check my HRV on my Apple Watch," but actually, it's not near as precise in the measurements. You take a $7,000 piece of equipment versus an Apple Watch, and guarantee you're going to get a lot more, specific results. So then we'll take a baseline, and then we'll hook up the master reset, which is that using the Newbie in a different way. So you want that balance between your sympathetic and your parasympathetic nervous system. And if you're in that sympathetic overdrive where you're constantly upregulated, your body has a really hard time sleeping. You have a hard time, you have some digestion issues. That ability to rest and recover is, it's not near as optimal as what it should be. So then what we'll do is use the master reset. We have packages that we do, and we'll set the electrodes at their neck and at their feet. We'll put them in a quiet room. We'll make sure we'll get rid of, depending on the situation, get rid of the technology out of the room and let them, comfortably rest for 20 minutes, generally about 20 minutes. And then we do that once a week. And then we'll reassess their HRV measures. And even without doing anything, we've actually had coaches, they need it,
Yeah.
coaches, athletes, people with that. When I had COVID, and when I had the flu, it's one of the things that I'm like, just bring a Newbie home and let me veg out on it. And it definitely helps reset your body. I think any PT, I don't know of any non-stressed PT
Sure.
that's out there. And your ability to sleep, and I sleep terrible, especially in my age. It's harder for me to sleep. So, but using that master reset, we even have staff that during the lunch, they're like, "Oh, it's just that helps," because it relaxes you without a drug. It makes you, it's like that more aware. You're more in tune. So you don't, in fact, I think they were studying the military with it, because can you balance your nervous system from a combat situation to that ability, like, okay, you've got to be able to sleep. Can you dial that back in a relatively quick period of time without, any drug or stimulant or anything that's really going to calm your nervous system down, because there's only side effects to that. There is no side effects.
So, I mean, to me, that sounds like its own business within the business. Obviously, that's something that whether you're doing it mobile, you're going out to the patient's home, delivering this experience, you're doing it in a clinic. We have a building that we're going to go visit later today where I have all of these empty rooms and I have no revenue coming from them. A couple are rented to massage therapists, nutritionists. But I'm like, what am I going to do? I've got the space. I've got the resources. I didn't even know about this. I'm glad you brought it up, because I just think, these are the things, once again, that we don't even realize has the impact and the value that it has. It's certainly not covered by insurance. So we don't even have to deal with, is this covered? Do I have to bill Medicare for it? But it could be something that's running in the background. It could be the cash cow that drives the business, that allows us to do what we want to do in other patient care aspects where we're losing money. Something has to pay the bills.
And I think, go ahead.
I was going to say, Jackie, let's say a patient comes to you and says, I know all about health insurance, and I have Medicare, and Medicare pays for electrical stimulation. So I want you to bill my Medicare.
Well, my take on that.
But I want the Newbie experience, but I want my Medicare to pay for it.
Well, you can do like what we did. We are now non-par, not accepting assignment with Medicare. So
there you go.
and let me tell you,
Same with us.
Yeah, it Medicare, it is like it is. It's every insurance company, they don't want to pay for anything. Well, I'm not investing like we have a lot of money invested in modalities, and we have to recoup that. And if you want a better outcome, this is what depending on the way you use the newbie, I mean, there's some things that we use. I'm like, okay, that's definitely a neurally driven, a neural driven tone issue. Okay, fine. You have spinal cord injury. We use it a lot, and we use it differently than I think how other clinics use it, but on how we can facilitate movement a lot, more effectively using the newbie. So those things are definitely neuro re-ed. And then there's some other things like what we use with our athlete program, our peak performance program. Yes, they want to be better, faster, stronger, but a big component of that, not outside of nutrition and things like that, is what's that recovery look like? You need to have a really good recovery program, and that recovery program, that's how you can use the newbie in that capacity.
Hey, before we run out of time, I want to hit some of David's questions because I think it would be great to go through some of those. I'm going to grab them and bring them into the conversation. Let me see here. So, and remind me, do you know David Harvitz? Do you know him personally? Have you met?
The name sounds familiar. I don't think so. No, I definitely have not met him.
Okay, I think he's on Long Island, but I might be right. I don't know. Anyway, David made a post. He basically asked 3 questions. He said, and I believe David is minimum out of network, if not all cash based. But David said, are you willing to pay out of pocket for medical services from a provider who guarantees results? So he is asking other therapists, are we as therapists, as part of the background, are we willing to pay for services with a provider who guarantees results? Let me hear your response, Dave, and then we'll kind of contribute.
Yeah, because I want to hear Jackie's answer to that as well. So for me, my wife Annie is a physical therapist as well. Obviously, we've treated each other over the years. I've also paid out of pocket to go to Kellen Scantleberry's Stick Club physical therapy. So I've paid out of pocket before. Years ago, I had like an elbow issue. I had a hamstring issue. So I've paid out of pocket, and he did not have a guarantee in terms of his offer or results or anything like that. For me, if there's anyone in New York City, and I think we've tested it, we had it backfire years ago, and I don't know if we have time to get into it, but happy to discuss it. We had an issue of the 100% money back guarantee for the first visit. But if a therapist or provider in the New York City area was offering that guarantee for some type of outcome, I would be even more inclined to use them or seek them out or go to Long Island or whatever to do so. But that's me. I think I'm a little different. Like I'm already paying out of pocket for something that maybe I could have self-treated, or maybe my wife probably treated, or we were busy and she didn't have time, or we just didn't focus on it enough or whatever. So yeah, like I've paid out of pocket. I paid out of pocket for Invisalign for my teeth. I mean, I've already paid out of pocket for other things. And if there was an offer of money back guarantee or something like that David's talking about, I would be even more so inclined to do so, because it's like uncommon. It's so rare. But I would love to hear Tony or Jackie's thoughts and they answer the question.
Jackie, you're up.
I think I don't even think you have to really sell it, because health is wealth. And if you don't have your health, it doesn't really matter. People spend $600 to go to a Swiftie concert. People say they, like, oh my gosh, this costs a lot of money. Well, if you can't move, if you are in pain, if you're not feeling well, I don't care what you have, it doesn't really matter. So that investment, to me, and I think that's where physical therapists, we can expand our practices. We can sandwich everything. And that's what we want to do. Like, that's what we're building too, is that what can you do as far as prevention? How can you do with rehabilitation? And then what can you do with optimization? And the underlying current is, with all of that. I mean, we use a lot of modalities, but there are things that we can do. Your body is an electrical being, and there's so much that we can do that's non-pharmaceutical. Believe me, when you need meds, you need meds. When you need a surgeon, you need a surgeon. But what are all those steps that we can take ahead of that? that I think that's where the power is.
But what if it doesn't work for me, Jackie? You're saying if I move to Coldwater, I don't have insurance, it's $180 a visit. Wow, that sounds expensive. Like, what if it doesn't work? What if I don't improve?
Well, first of all, it just depends on like say you did come, like we need to have that discussion. This is what I'm willing to do. What are you willing to do? We need to have that discussion of like, I can do we can do a lot, but you have to have some ownership in what is going on. And like, that's like how our solutions based off of what I'd like to build out is like, how do you answer that how do you answer that question? If after a month I'm not better, then what? I'm not going to guarantee you that I'm going to, see you, until you're better. Not all conditions are going to get better. But first of all, I'm going to do my best damn care that I can give you. But then I'll extend that care out. I'm going to give you everything I can in the next 30 days and then cap it so that we know that there's an end. And then, what does that end look like? And we need to be on the same page of like, this is what's realistic. This is what is optimal. And this is what your responsibility is in it. Because who's to say that they don't do something outside of therapy? They don't trip, they don't fall, or they smoke or they drink or, whatever it is to say that I can get you 100% better. Maybe.
We've done, and we still do. I just ran an ad recently where we had a money back guarantee. If I can't improve your knee range of motion more than 10 degrees, I will absolutely give you your money back. I think the first kind of impression is money back guarantee is a little weird in healthcare. It's going to make everybody uncomfortable, first of all. I don't think you can guarantee the result. I think you can guarantee the experience. This is what we're going to deliver. I guarantee that we're going to deliver this, whatever this may be. But I know, just following David for so many years, like he is so committed, so passionate. He believes so deeply in what he can deliver. I remember Dean Volk. Dean Volk used to offer and make offers like that. He asked people, he was like, look, what if I could guarantee your sciatica pain is gone without surgery, without drugs? What is that worth to you? And I still think there's something on the consumer's mind where it just sounds unbelievable. If you can fix, air quote, fix me, why isn't everybody, doing this? Why are you so special and so different? And I think that immediately takes the consumer into suspicion. So for me...
Yeah, we've been indoctrinated that, though. That is the way our healthcare system has been set up for all these years, that what has been, like, it really didn't pay before. It really didn't pay for us to really get them 100% better.
So I like where he's going with it. I like the intent behind it. I would say if I was on the consumer side, if it's something that I would typically expect insurance to cover, and I think that's the intent here, I would be immediately suspicious if you're going to make a guarantee. And then I'm going to go to, well, what do I have to do? Do I have to jump through a bunch of hoops? Do I have to do all this other stuff? I am just inherently suspicious of money back guarantees in general. His second question is there a price limit to what you're willing to spend for medical or pain related issues? And this is another one, is there a price limit? So like as clinicians, the truth is most of us are struggling financially. We shouldn't be, but we are. So it's like, what is it worth it to you to eliminate a pain problem? Well, how is this pain affecting me? What is this pain keeping me away from? I literally, before we started recording, I'm in my clinic at the counter. A patient came up to me. I was like, hey, I've got this bursa, he's got a Baker cyst in the back of his knee. It's been bugging him. He's like, I can walk, I can run, I can do everything. But when I squat, it bugs me. I'm like, well, we have a soft wave. We can do stuff that might help you. But what is it worth to you? Is it worth $500 to try and resolve this nuisance issue? He's doing everything he wants to do. He's like, nah, it's not worth that. So it's like, all right, no problem. We're good. What were you going to say, Dave?
Well, my thought on the second question is, it is wildly different, such a spectrum of some people that will actually never pay anything to have any type of conservative care, like Jackie said, that can actually help, that's got proven results, and she's got video testimonials and all that. Like, obviously, there's a ton of folks that it helps. So even if someone had a ton of chronic pain, could it help take off 25? Could it ease their pain 25 or 50%? So that they can still have some pain, maybe, and still, but move better and live better and whatever. There's some folks that obviously have more discretionary income that'll pay thousands. Like we have patients that pay a lot, sometimes a lot of money. We have some patients and clients that try us out for 1 or 2 visits, and then we have others that spend tens of thousands of dollars with us. It's insane. So another example is that we had a friend of a friend, and they were trying to refer the mother-in-law to our physical therapy practice. And then Annie, my wife, did a phone call with that individual. And then Annie went back to the referring person, the friend, and said, "Oh, I spoke with your mother-in-law, blah, blah, blah," because the friend was trying to help out. But then the friend, and this is maybe a Brooklyn thing, Tony, maybe a New York or Long Island thing, but the friend said, "I wanted to help out. I wanted you to, speak with her, but I didn't think she's actually going to go forward and actually put the effort in and pay out of pocket with you guys. I know you guys are great, and I referred her to try to get some, credibility or clout in the relationship or whatever." But the referring person said, if you helped her and you got rid of her knee pain, she wouldn't have anything else to complain about.
Yeah.
And some people, their identity is wrapped around that issue or that condition. That person not only would never pay $1,000 or $5,000 or $10,000 or whatever out of pocket to get better, they also probably couldn't even be paid $10,000 to actually go and do the newbie or go to cold water or go to, Tony Maritato's clinic or whatever. So it is wild. Like the span, like for me, Tony, me, like I would pay to go to cold water if I had some, rare neurological condition, and I could see how some people would do that. But then there's other people that will absolutely never do that. And it's just truly fascinating.
What's your experience with price point?
So some of that price point has a lot to do with me, because I'm always if I could give it away, I would. But now I'm to the point where, and this is completely stolen material, but I want to build a revenue stream that I want my vocation also to lead to more, money that I could do advocation. So I can give, and serve those people that can't afford it. So I want a little bit of a both, but I do feel that we have to, like, what we do is so undervalued, and it can be so much better, and it's really hard. But in our area, a lot of people are just very tied to their insurance, but the better outcomes that you can give. And I think you put up one of the best points. It's like, you may not give them a result, but you'll give them an experience. And I do think, like, our clinic I am proud of our clinic. I'm proud of our team. It's a first class operation. And
Yeah.
it wasn't given to us. Like, it was all hard work, and everybody helps, we all pitch in. And I think there's value in it.
I think an important aspect, before I get to David's last comment, an important aspect of what Jackie does is, I came out of the mindset of modalities are a waste of time. Modalities are no better than placebo. Modalities are just turning electricity into dollars. It's an ATM. It's all a scam. But I think part of that is when you're looking at it as, okay, this person using the modalities has no clinical knowledge, no clinical background, no understanding. It's a very different use of modalities when you have somebody that has a solid depth of knowledge, who is genuinely passionate about doing what's in the best interest for the client. Now, I think without context, you don't know who has that kind of passion, that kind of belief, and who doesn't. You just see what's out there on social media. But knowing Jackie now, having been to her clinic, having seen her team and what she's doing, and just her like, she lights up when she's talking to an actual patient. There's nothing fake about that. You can't make that up. And so understanding that if a therapist can have the depth of knowledge and the passion and still use modalities in a constructive way. This is something that I think at large we're not used to, because we're still used to the 300 plus thousand PTs out there that are fed up, burnout, underpaid, overworked. They're slapping on electrodes without any consideration of what it's doing, just so they have a little chance to breathe. That is a very different experience than what Jackie's been talking about. So the last part of what David said was, if your doctor referred you to a PT and said, look, they don't take insurance, but it works. The PT, they don't take insurance, but what they do works. Would that stop you from at least calling them? I'm going to say it would probably stop me, honestly, because I have a negative association. I have a negative association with what most clinicians do. I would never, I'm not going to say never. I would very unlikely go to a physical therapist. I know PTs who go to PT. I think you, Dave, have gone to a PT for treatment.
Several.
Yeah, I generally would never go to a PT for treatment unless I absolutely knew the PT on a personal level. I understood the mindset and the philosophy of the PT, and the PT was genuinely delivering something that I couldn't access somewhere else. And in that situation, yeah, I would pay. It wouldn't stop me from calling, but I think the first gut response is, no, I'm not going to call, because they're just going to try and sell me into something. And then I'm going to have to go through the dog and pony show to like let them give me their sales. And then I'm going to say no, because I'm not going to want to waste money on stuff that's not going to help me. That's the gut response. That's the reality of me on the consumer side. I assume you have something different.
Yes, Jackie, if you don't already know, Tony and I, we love each other. We've known each other for 10 years, but there's at least one crossroads in every episode where we greatly disagree, and there's a divide. This is it. If this comes from a physician, Tony, this is like leverage word of mouth. If the physician says, hey, they're expensive, they're premium, it's out of pocket, but it works. They get great reviews and testimonials and all that. I understand. Maybe there's some percentage of the population that is like Tony. They're going to take it that way. I don't know. I think 75% of it, and maybe it depends on the city or the state or the area, the demographic or whatever, but I think 75% of the referring patients that physician is saying that to, I think would consider paying out of pocket more all of a sudden, when right before that conversation, they might have been insurance mindset or insurance minded about their physical therapy and their care. That's just me with my, I don't know, Northeast or New York City bias. But if that's a physician saying that in New York City, closer to, I don't know, 80 or 90% of the potential patients would now have a reason to even make that call, to reach out. And now they're even, they're told up front that this place doesn't have, that they don't take insurance or that they're out of pocket or whatever, which is that's even better than when we're running Google ads and people are looking to sometimes use their insurance. We get them on the phone, we go through the sales process and kind of lower their guard. And now they understand the value of why they would pay out of pocket for these types of offerings.
Before I let Jackie answer, I will say it probably goes one layer deeper. I don't trust the physician.
You're such an oddball consumer. Let's just put it out there, right? Jackie. For anyone listening right now, Jackie is almost choking Tony out. So Jackie and I we're in agreement. Love it. I
just generally think the physician and I don't agree on most things anyway.
Well, then why are you there? Why are you in this physician fake exam? Why are you
out of obligation most of the time? My wife's like, you need to go get a physical. You need to have somebody involved. But again, I'm using myself as I think I represent a large portion of that patient community. I don't trust the doctor to really understand the full context of my situation in 5 minutes that they spent with me. I don't trust, I think they think they're doing what's best. Don't put me on Lipitor. Don't give me a statin.
Agree. I can agree with you on that.
Okay. We're gonna wrap up the show. What is your take on, if they say, hey, it works, will you at least give them a call?
I think depending on where you're at, I do think it has to do with where you're from, but a lot of people still have, I somewhat disagree, because I do think physicians still in a lot of people's mindset have a their opinion is a little bit more elevated.
Higher status.
Yeah, it's a higher status. And they are going to, if they can't fix you, they don't want to do something that's going to make them look bad. When it comes down to orthopedic surgeon or a physician, they don't want to look bad. They want to look good. And so I think they wouldn't want to refer you to somebody who just doesn't know what they're doing, that has, some shoddy experience.
So we have a tradition on the show. Jimmy McKay started it. We leave people with a parting shot, just a quick one idea. What would be your parting shot for anybody watching this who might be thinking about bringing in modalities, changing their business model, going out a network, any of the stuff that you do?
Personally, the first thing that comes to my mind is that using this, instead of being burnout, this has become a fountain and not a drain to our practice.
Beautiful. Yeah, that's perfect. Dave, what you got?
I love it. I have not experienced the newbie yet. I have experienced certain devices, similar to it. I want to try it out. Jackie, you're showing what's possible. And this is, I think, part of the future of physical therapy, which is getting out of all these in-network insurance contracts. You're going out of network with some of the out-of-network payers, depending on if it's offered in the area, if there's companies that have out-of-network benefits for their employees or not, or it's just mostly out of pocket. I looked up on Google Coldwater's population, the census of 2023, 4,712 residents in Coldwater. Yeah. And here's a practice, Jackie's practice, that is spending a ton of money investing in modalities. So not just the newbie, the spinal decompression table, the blood flow restriction, microcurrent, cupping, dry needling, Graston. That all takes money and time to train their, team and their employees and all that. Jackie mentioned the investment and trying to recoup that investment. So you guys have laid out a lot of money for a lot of these modalities, and you guys are getting results. You're getting folks to pay out of pocket in such a very small town. I mean, that's like, I'm from Maple Shade, a small little town in South Jersey. I think it's around 5,000 to 8,000. So it's a very similar size of population. So I understand the size in that area. So this is what's possible. This is what's possible. You don't have to keep the insurance mindset. You can do things differently. And by the way, this is not a commercial. Tony and I are not paid by Newbie or Jackie. None of us are paid by Newbie to do this. We're just chatting about this. So we don't benefit at all if you go and buy it or not, or you mention Jackie or you don't, whatever. But it's just fascinating to see what's possible.
Yeah. And then for the record, I am going to talk her into two things before she leaves today. One is a live event up in her area in Coldwater so that we can bring clinicians out there. We can teach, we can educate, we can share ideas, show them what she's built. And two, raising her prices, like raising the prices of the evaluation, the first time experience, just because there is so much value in what she is delivering. Anybody willing to go to Coldwater is willing to pay $500 if they're willing to pay $200. Like, the cost isn't the experience. The cost is getting there. All right, guys, go check out the Dave Kittle Show. Check out Learn Medicare Billing. Check out PT Pintcast, and come back. Dave, as always, thanks for joining us.
Thank you so much for having me.
Thank you, Jackie. Nice to meet you. Thank you. Hey, it's Dave Kittle. Are you a healthcare business owner or physical therapy practice owner who is looking to figure out your succession plan or exit strategy? We might be able to help. And in fact, we may be interested in acquiring your practice. If you're interested, you can reach out to me. Shoot me an email at dave@conciergepainrelief.com. That's DAVE@CONCIERGE painrelief.com. Or you can call me at any time, 646-781-8884.